Thank you. My name is Mutemba. I am from Mozambique. I will present improving antiretroviral treatment continuation among children living with HIV in Nampula, Mozambique. Mozambique, according to the National Prevalence Population-Based HIV Survey, is at 12.5%. And the HIV among children in Mozambique per UNAIDS data, and where's the data we saw this morning, that we have a lower awareness of HIV among children, also low coverage antiretroviral treatment, and the viral load suppressed also lower in this group. And not the far in Nampula province, that is located in north of Mozambique, that the prevalences are around 10%. We defined this programmatic implementation has a treatment continuation at a 3 month, a proportion of children newly enrolled on ART 5 months prior to the reporting period and hand date who have clinical consultation or ART pickup drug between 61 and 120 days after initiation. And this is schematic. We want to show example that each children when is enrolled in the course studying, for example, in a month, should be in reporting period, we want to be retained on care at the 3 months of treatment. And then we decided to analyze if the set of interventions are effective for improving the treatment. And this comprehensive package of intervention was implemented in Mozambique for first one, linking the diagnosis with children living with HIV, initiating ART, phone call reminders, expansion of HIV service community level, roll out the optimized ART regime, also the intensive monitoring if it's going to improve, these interventions are going to improve our continuation on treatment. First, I'm going to go through of each intervention, and the first intervention to linkage since the mother is enrolled in care and antenatal care, we allocated the mentor mother to be tracking this woman to ensure that this pregnant or the breastfeeding woman coming for the visit and pick up the ART drugs, facilitate the PCR testing, also the rapid test for the children, identification, the diagnosis. Also, they have the online tool that they can flag to collect sample for the patient, also the logbook register and monitoring this group. And this is complemented with the initiation RT and using DSD module for 3-MDD, 6-MDD according the guideline, and the family approach, that's a one-stop model consisting the HIV care and treatment for the parents, also the children, where they are receiving all care that's necessary. The phone calls reminder, it means that the mentor mother is responsible to conduct the reminder phone call 1 or 3 days before the scheduled appointment. But if these children are missing appointment, immediate the outreach for those children are made by these mentor mothers. The expansion of HIV community level is delivered health service in the community twice a month that we are doing with the multidisciplinary team that we have a clinical technician, maternal child nurse, lay counselor, and mentor mother, and that beautiful car that's there. and then we schedule for these days to go to the community, and then they can have the outpatient consultation or HIV and TB screening, testing, sample collection. Also, they can initiate the RT, also continuation of the RT according the schedule that were made with the mothers. The optimized regime, when was rolled out in Mozambique, the Minister of Health was able to adapt for the reality of the country, and we're introducing and training the healthcare, caregiver education, also design the guidance, and right now all children are already on optimized regimes. The other intervention was intensive monitoring, a weekly based review, and this indicator is generated using our electronic patient tracking system, and they are able to get the results, also the list of patients that can triangulate these patients using the tools that are in the health facility. Also, there are SOPs that we are using for that, and we are reporting weekly for using the online tools that are described there by district. In terms of result, we started with baseline that was 57% of patients, and this intervention was introduced step by step because it was according the guidance that WHO was giving us, and the country was adapting. And then in 2021, all this intervention was already implemented in the same time. It means that until now, the results that we are seeing is stable. All the intervention are already implemented in the sites, and then we are following up using those reports. Here we want to show by district that is in the beginning the result was low, but for example I will go to Nampula, and you will see that started with the 25. It means that the children that were there were retained, all them now in July 2022, September 2022. But the variation on this district, you can see there is some that not improve. It means that because the number are low, when one children missing appointment, the result is going to go down. In conclusion, we want the implementation of target intervention combined with intensive monitoring, data use, lead improvement in treatment, continuation outcomes, and children living with HIV. And the continuation of treatment in first 3 months, it's good signal for long time engage in care, because a lot of interruption on treatment in Mozambique has happened in first 3 months. Continues to access the gaps in design contextualized interventions to address remaining challenge for the treatment continuation in the vulnerable population is very important, because we are adapting according to the situation. The implementation researchers generate future questions that was important to conduct analysis of course patients, looking into the treatment outcomes among children living on different service delivered model. Also, the social demographic factors and their association with treatment continuation will be examined to identify that the children living with HIV who need special attention. I would like to acknowledge the Minister of Health and the provincial and district teams, health facilities leadership and staff, HICAP teams in Nampula, and our donors that are PEPFAR through CDC. Thank you for everyone for listening to me.